Hi, my name is Felicia McNeil. I'm a student, the LPN to BSN program at Indiana State University, and I am here doing a community-based project for age group 14 to 59. My instructor is Dr. Lucky, and this is just a community project. So, what we're going to talk about initially is HIV and AIDS, facts that you need to know. What do you need to know about this particular virus? But before we get started, we're going to test your knowledge today and see what you know about the virus itself. So if you click down below, you will see this pretest right here. So it has 10 questions on there. It's 4 multiple choice questions. And so you're going to answer these for me. And then we're going to go through the presentation. We're going to go through and we'll get all these answers to make sure they're correct to match with yours. So just click the link down below. And then we're going to let you guys take your pretest and we'll be right back. All right, so now that everyone's done with the pretest, we're going to start with the presentation. Okay, so this is facts you should know about HIV and AIDS. So the reason why I combine both of these together is because they kind of go hand in hand. Because HIV is a virus that attacks important cells in the human body, primarily your immune system. The virus contains destruction of these cells and makes the body weak and unable to fight, which is why you have a low immune system. They call this the autoimmune disease. So HIV, human immunodeficiency virus. So the prefix for that is just HIV. So HIV infected individuals can spread the virus for years without knowing they have the virus. So we're going to stop with the HIV portion and we're going to continue with the AIDS portion because they go hand in hand. This is just defining what they are. So what is AIDS? So when HIV is left untreated, it will eventually lead to a life-threatening illness known as acquired immunodeficiency syndrome, AIDS. AIDS within time in the body will weaken the immune system, weaken the body's and the entire secondary infection to the body as well. So some people may ask, what is a cure for this? And we're going to go through our all of our objectives is the questions that I ask during this. So how is the virus spread? Well, HIV can be spread through semen, blood, vaginal fluid, breast milk, and other bodily fluids. And it's like, what's the most common way to spread AIDS or HIV is through unprotected sex. This includes vaginal, oral, and sexual. But this is not the only way this virus can be spread. This virus can also be spread by having a blood transfusion. They try to make sure they type and cross to make sure there are no diseases or anything with blood, but you always take a risk when you have to have someone else's blood to have a transfusion. So, but HIV or AIDS cannot be spread through drinking from a water fountain, sitting on a toilet, insect bites, sharing food utensils, or hugging them. You can't get HIV from that. How can one avoid the HIV infection? So the only way to 100% avoid with far as sexually is abstinence. You can use condoms, dental dam, but that is not 100% guaranteed. The only 100% guaranteed to not acquire this virus, HIV AIDS, is abstinence. Now, as far as blood transfusions, there's nothing you can do about it. You can ask about testing. Was the patient tested thoroughly? That's all you can do about that. So when you're working in a healthcare setting or even out in the community, you want to make sure that you avoid like needle sticks, tattoo tools that are dirty. You want to make sure that you stay away from those because those are also ways that you can contract the HIV virus as well. How do you know when you're infected? Well, first of all, you want to make sure you get tested when you're sexually active, especially if you're not using protection. Testing is important, mostly for up to 10 years. Someone with no signs and symptoms can spread the virus without even knowing that they have it. You want to make sure you try to keep the same sexual partner. Having multiple sexual partners increases your risk for having HIV and AIDS if you're not using protection. So if you do get the HIV virus, what do you do next? Well, if you think you have the virus, you need to follow up with your primary care provider for testing. If you don't want to go to your primary care provider, the health department is also a great source for this particular virus itself. Now, if you notice, I said it's a virus. It's not a STI infection. This is an actual virus. With virus, there are no cures. You can only treat the symptoms of this virus. If you are a virgin, do you have to worry about HIV? Yes, you will still have to worry in the event you got a blood transfusion or you had a needle stick or a used tattoo needle. So those things you have to make sure, because this virus can be spread. It's not like your other STDs, chlamydia, gonorrhea. It is not like those. This is a immune deficiency virus. And other sources that you can use to maintain information, you can go to the CDC. They have great resources for this particular virus. So I'm going to talk about, does this particular virus cross the placenta during pregnancy? Yes, it does. It does cross the barrier, and your child could, if you are infected with HIV or AIDS, it's a possibility that your child could come out with the AIDS virus or HIV virus as well. And like I said, most people have the virus and they don't know they have it. So you ask about how many people in the U.S. Within the last 5 years have had contracted AIDS. So it's 1.2 million people have actually contracted the virus. So they also asked what gender spreads the virus the most, and it's men on men sexual contact is what the references from the CDC stated. Men are the number one contractor of this virus. Can the HIV virus cause cancer? No, it's not like your HPV virus or anything like that. How do you determine if you have the HIV virus? Well, the only way to determine that is through a blood test. They'll test you, and it takes about a week for the test to come back. They have some rapid tests, but those are like preliminary results, and then they'll test out further, especially if you have a positive test. Does a person with HIV, are they symptomatic? Well, when they become symptomatic, it's a full-blown virus at that point. So they have flu-like symptoms, fever, sudden onset of weight loss, and in advanced stages, and even the AIDS virus itself, they could have what they call pneumonia carne, which is an pneumonia that only affects people with HIV or AIDS. So is there a cure for AIDS? There is no cure for AIDS. And people ask, will I die from AIDS? Eventually you will, unless you stay on the medication. Some people have lived with it for years, but eventually end up passing away. Sometimes it's from the actual virus itself, and sometimes it's from the symptoms from the virus, which is still an issue for the virus itself. So if you look down below, you'll see that I have also included a pamphlet which gives you more information on everything we just talked about today. And mine is in black and white, but you guys are in color, so I did y'all's a little nice and fancy. But this right here is the pamphlet, and it has all the information on here. And if you look at the back page of the pamphlet, you will see your sources, where do I get information, your CDC, your health department, and the sources that we use to find information from this actual pamphlet that I use. You'll find those sources here. So I want to thank you guys for your time. And so if you click down below again, you'll see the post test. So if you guys will go do the post test for me, this is just everything we talked about. And I just want to see if you learned anything or retained any information that we found out. Always remember, protect yourself and wrap it up. Thank you.